Your daily 60 seconds dose of high yield INICT facts. PECARN pediatric head CT rule. So in this rule, we need to focus on, are we going to take a CT or not in a pediatric head injury or not? So first you need to consider younger than 2 years, or there is an altered mental status, or GCS is less than 15, or there is a palpable skull fracture. Then you can go for a CT if these are present. If these are not present, then you can go for LOC of more than 5 seconds, or non-frontal hematoma not acting normally, or severe mechanism of injury. If none is there, then you don't need to require a CT. If any one of this is present, then you need to go for a CT. It's PECARN pediatric head CT rule. Thanks and subscribe to Dr. APS podcast.